Hello guys, today I brought some competitive questions for your government preparation. So these questions will help you to clear the government exam. So let's start the question. First question is, during a prenatal visit, client at 36 weeks gestation tells a nurse that she has painful irregular contractions. What should the nurse recommend it? So there are four options to choose a correct answer. First option is lie down until they stop. Second option is time them for at least 1 hour. Third one is walk around under the subside. Fourth one is take one over the counter analgesics. So let's see what is correct answer. So C is correct answer. Why it is correct? See, ambulation decrease irregular contractions. When patient will walk, then irregular contraction will stop. Preparatory contraction increase when the client is resting. Like women जो है अगर continue rest करती है then preparatory contraction can start and they will stop when the woman will walk. Okay, these contractions are not indicate of true labor and need not to be timed. Okay, medications should not be recommended by the nurse. This is depend on the nursing function only. Okay. Second question is, a healthcare provider prescribes losartan for a client, which is most important nursing action. So there are four options. First is assess the client for hypokalemia, ensure that the medication is ingested with food. Third one is monitor the client's blood pressure during therapy. Fourth, teach the client missed dose can be double at the next scheduled time. So let's see what is correct answer. C is correct answer. Why it is correct? C, monitor the client's blood pressure during therapy because losartan is an antihypertensive drug. It blocks vasoconstrictor and aldosterone produce effect of angiotensin second at receptor sites. So, lower of the client's blood pressure reflect a therapeutic response and should be monitored frequently. Okay, a client may be at risk for hyperkalemia, not hypokalemia. B. Losartan may be taken without regard to meal. Okay, and double dose is unsafe. A missed dose can be taken as long as it is not close to next scheduled time. Okay. Third question number. During postpartum period, a nurse identifies that a client rubella titer is negative. When action, what action should the nurse plan to take? So there are four options. Check for analgesic to penicillin. Alert the staff in the newborn nursery. Okay, assure the client that she has active immunity. Obtain a prescription for an immunization before discharge. So let's see correct answer. D. Obtain a prescription for immunization before discharge. Why it is correct? A negative rubella titer indicate no immunity. Immunization are given safely during the immediate postpartum period. Okay. During pregnancy, बहुत सारी vaccination या medicines we can't give. Okay, but during postpartum period we can give rubella titer. So penicillin will not affect the client's immune status. The mother's negative rubella titer does not affect the infant. That's why we can give at the postpartum period. A client will a negative titer has no immunity to rubella. Okay, so answer number four. An infant with hydrocephalus has a ventriculoperitoneal shunt surgical inserted. What nurse care is essential during the first 24 hours after this procedure? There are four options. First is medicating the infant for pain. Second, placing the infant in high follower position. Third, positioning the infant on the side that has shunt. D, monitoring the infant for increasing intracranial pressure. So let's see what is correct answer. Correct answer is D, monitor the infant for increasing intracranial pressure. Why it is correct? The shunt may obstruct, leading to accumulation of cerebrospinal fluid and increase intracranial pressure. That's why D answer is correct. Although provide pain relief for infant is an important part of post-surgical care, monitoring for potentially severe complications such as intracranial pressure take pre. Okay. B. Positioning the infant flat help to prevent complications that may result from too rapid reduction of intracranial fluid. Okay, C. Infant is positioning of shunt to prevent pressure on the valve and incisional area. Okay, so fifth question number. An older adult is hospitalized for weight loss and dehydration because of nutritional deficit. What should the nurse consider when caring for this client? So there are four options. First option is financial resources usually are unrelated to nutritional status. Second, an older adult's daily fluid intake must be markedly increased. Third, the client's diet should be high in carbohydrates and low in protein. D. The nutritional needs of an older adult are unchanged except for the decreased need for calorie. So let's see what is correct answer. D is correct answer. The nutritional needs of an older adults are unchanged except for a decreased need for calories. So why it is correct? A well-balanced diet for fewer calories because of decreased metabolism is suggested for older adult. ओके, अकॉर्डिंग टू एज मेटाबॉलिज्म प्रोसेस जो है वो स्लो हो जाता है, इसलिए हम जो डाइजेस्टिव चीज़ें हैं वो हम प्रिस्क्राइब करेंगे फॉर द ओल्डर अडल्ट. सो और लो कैलोरी डाइट देंगे. ए, लिमिटेड फाइनेंशियल रिसोर्सेज आर वन cause of malnutrition in the older adult. B, fluid needs not to increase. And older clients who become dehydrated probably is not maintaining a minimum fluid intake. Okay, high carbohydrates will provide excessive calories which may result in obesity. 6. A healthcare provider older peak and through level of an antibiotic for client who is receiving vancomycin IV. Piggyback when should blood sample be obtained to determine a peak level of antibiotic. So there are four options. First is anytime it is convenient for client. B, between 30 and 60 minutes after a dose and halfway between two doses of drug. D, at 30 minutes before the medication is administered. So B is correct answer. Between 30 and 60 minutes after dose, we can take the sample. Because the drug was just administered, the blood level of drug will be at its highest. Okay, so this will produce inaccurate result. Peak or through level are measured in relation to time a drug is administered. See, this result will reveal a drug blood level halfway between peak and through level. Okay, this is done for through level when the drug level is at its lowest. So, question number 7. A nurse is teaching a client who has arthritis about the steroid medications prescribed by the healthcare provider, which client statement about why it is important to take steroid medications at meal time indicate that the teaching was effective. So there are four options. First is the presence of food is will enhance the medication's absorption. B, taking it with meal serves as a reminder to take the medications. C, food will help decrease the gastric irritation effect of medication. D, the acid medium in the presence of food make the medication more effective. So C is correct answer. Food will help decrease the gastric irritation effect of medication. Why it is correct? The presence of food limits the irritation effect of steroid on the gastric mucosa. ओके जो मेडिसिन का इफेक्ट है जिससे कि गैस्ट्रिक इरिटेशन होगा, अगर हम फूड लेते हैं वो उससे डिक्रीज हो जाएगा. ओके जब हम फूड लेते हैं उस टाइम में जो इरिटेशन ऑफ गैसेस या गैस इफेक्ट ऑफ मेडिकेशन है वो कम हो जाएगा. A, food does not decrease absorption of steroid. It may help the client remember to take the medication, but it is not the reason for taking with meals. Okay, like जब भी हम फूड लेते हैं तो वो हमें रिमाइंड करा सकता है कि अब हमें मेडिसिन कब लेनी है, बट एक कोई एब्जॉर्प्शन के लिए यूज नहीं है. द मेडिकेशन इज नॉट अफेक्टेड बाय एन एसिड एनवायरमेंट. ओके next 8 question number. What is the priority nursing interventions on admission of the primary gravida? Monitor the fetal heart rate. Ask the client when she at last. Okay, obtain the client health history. Determine if the membrane have rupture. So answer is A. Monitor the fetal heart rate. Okay, why it is correct? Determining fetal well-being, all other measures. If the fetal heart rate is absent or is persistently decelerating, immediate intervention is required. This is important, but it is not a priority. Okay. And next question is 9 number. An external monitor is placing on the abdomen of a client admitting in active labor. The nurse identified that during each contraction, the fetal heart rate decelerated and as the contraction peaked. What should the nurse do next? So there are four options. First option is help the client to a knee chest position to avoid cord compression. Second option is notify the client, the health care provider because of possible head compression. C. Monitor the fetal heart rate until it returns to baseline when the contraction ends. D. Place the client in semi-forward position to prevent compression of the vena cava. So, C is correct answer. Monitor the fetal heart rate until it returns to baseline when the contraction ends. Okay. The fetal heart rate, why it is correct? You can see the fetal heart rate is expected to decelerate when the head is compressed during the contraction. If FHR return to baseline at the end of contraction, fetal well-being is indicated. Okay, cord compression during a contraction is a common occurrence. No intervention is necessary if the FHR return to baseline at the end of the contraction. There is no need for further intervention. This is an expected occurrence as long as FHR returns to baseline at the end of contraction. This position will increase pressure on the vena cava. Okay. So, question number 10. A nurse is caring for a client with diagnosis of bulimia nervosa. The nurse understands that individual with bulimia nervosa is food to gain attention, control others, avoid growing up, meet emotional needs. So there are four options. What is correct answer? Let's see. Meet emotional needs. Okay, why it is correct? The answer. So clients with bulimia eat blunt emotional pain because they frequently feel unloved, inadequately, and or unworthy. Purging is prescribed to relieve feeling of guilt for being and or to limit the fear of obesity. Okay. Option number A, the beginning and purging usually are done along and in secret. B, clients with bulimia often feel out of control and perform their behaviors in secret. C, this is one of the psychodynamic theory related to anorexia nervosa, not to bulimia nervosa. Okay.